Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Going to talk a little bit today about the medication Clopidogrel, 75 milligram tablets. Talk about the use, dosage, and side effects of this medication. First off, what is Clopidogrel? In the US, it's sold under the brand name Plavix. It's used to prevent blood clot formation, or you may see it listed as an antiplatelet. What it does is it irreversibly prevents platelet aggregation. What's platelet aggregation? Well, that's how your blood clots. Like when you cut yourself, the platelets aggregate or they stick together and it causes a clot. So clopidogrel prevents those platelets from doing that, which in certain conditions can save your life. So some of the uses for clopidogrel after a heart attack, there are certain conditions after heart attack that put you at high risk of having a stroke or a clot occurring somewhere in your body. And so the clopidogrel, you can almost think it makes your blood slippery so those clots don't occur. They use it as thrombosis. Thrombosis, just the medical term for clots after a stroke and other vascular issues. If you have narrowing of certain blood vessels, they can use it to prevent a clot occurring there. A condition called AFib, off-label use for clopidogrel. AFib is where the top of the heart doesn't um, always beat properly, and sometimes the blood can slightly pool, putting at risk of a clot formation. When you get a stent placement in the heart, they can use clopidogrel to prevent, again, clotting to occur there. Coronary artery bypass graft, which is commonly referred to as open heart surgery, when they put new blood vessels in the heart. Heart valve replacement, and then just other cardiovascular disease where you're at high risk of having a clot. Because again, that clot could cause stroke. It can occur in a limb, and it can cause a lot of problems, if not death, when you get a clot. So clopidogrel can really extend your life and prevent you from having a lot of issues. Really tolerated well by most people too. It is usually 75 milligrams once a day. Sometimes when you have a procedure or when they first start you, they may start you on a one-time dose of 300 milligrams, so 4 tablets the first day. There are other loading regimens too, so your doctor may advise you to take a higher dose for a while. That is common, just to get that on board so it's working in your body properly. Sometimes it may be used with aspirin. That, however, does increase the risk of bleeding, but it also reduces that risk of clot. So that's something your doctor is trying to balance nicely, preventing your risk of clot without increasing your risk of bleeding. Taken with or without food, clopidogrel is. Most common side effects, actually, for something that affects your blood like this, most people tolerate it amazingly well. Of course, it can cause some minor bleeding or some itching as a common side effect. Less commonly, we can see some backaches, nosebleed, stomach irritation, headache, high blood pressure, joint pain, and other side effects can occur, but these are the more the ones we see more likely. Um, and then serious side effects can also occur. As with many medications, a serious rash, and I know a rash doesn't sound like much, but we're talking full body rash. That can be very serious and you need to seek medical attention right away. Bleeding in the stomach or colon, as we kind of touched on, this medicine, of course, reduces clotting in the body. So it's going to put you at higher risk. So you need to take that in mind and be mindful of those side effects. If you notice that occurring, you need to seek medical attention right away. It can affect the white blood cells too. Again, not very common, but your doctor, it's of course why you want to see the doctor on a regular basis. They'll take labs and monitor for these sort of things and other blood disorders as well. Again, very rare. They may do some genetic testing. They've found there's a condition where they're classified as a poor metabolizer in this enzyme system, CYP2C19. And what happens there is clopidogrel has to be converted in your body to the active form. And people who test as poor metabolizers, they don't do that. So the clopidogrel just won't work as well for them. And the testing will show that, and the doctor will change to a different medication. It's not a large percentage of the population, but your doctor may wish to test for that to make sure the medicine is effective for you. Medication interactions with clopidogrel. We of course want to be careful of anything that can increase bleeding. So aspirin, NSAIDs are like ibuprofen, naproxen, um, Aleve, Motrin, Advil, all those increase the risk of stomach and colon bleeding. So you have to be really careful with clopidogrel. You'd only use that if the doctor recommends and for as short a period as possible. Of course, warfarin is can cause a lot of bleeding problems as well. So they're typically not going to be used together. SSRIs, they're medicines like Paxil and Prozac used for depression. They can put you at higher risk of having a bleed in the colon. They are used with clopidogrel sometimes, but one has to be mindful of their side effects. Clopidogrel, the effectiveness can be decreased by the heart medication amiodarone, certain antifungals, some calcium channel blockers, cimetidine that's sold under the brand name Tagamet in the U.S. Um, for stomach issues, fluoxetine for depression, PPIs like omeprazole, those stomach acid blocking medications we see commonly used with clopidogrel because taking the acid reducers can reduce the chance of a stomach bleed, but certain PPIs don't work well with clopidogrel, and your doctor may choose to use a different one. That's a conversation you can have with your doctor. And make sure when you see a different doctor, you let them know you're on Plavix, you're taking clopidogrel, so they keep that in mind if they have to prescribe you something else. I do appreciate you watching. I hope you found this information useful. You always talk to your doctor or pharmacist if you have a problem with this or any medications. As soon as you notice the slight possibility of a side effect, you let them know. The sooner they can mitigate the side effects occurring from that. You let that go too long, you could have a big stomach bleed or a lot of issues. So contact them right away. Always reach out if you have questions and subscribe to my channel. Thanks for watching.